Welcome to another episode from the Veterinary Research Channel. Today, we delve into a fascinating study published in the Journal of Veterinary Internal Medicine in 2024. This research, led by Maxime Kurtz and colleagues, explores a new way to tackle a common yet challenging condition in our feline friends, pyelonephritis, which is a bacterial infection of the kidneys. The authors begin by highlighting that diagnosing pyelonephritis in cats is often difficult. While we recognize this disease as a significant cause of acute worsening of chronic kidney problems, the typical signs we look for can be vague and not always present. These signs might include fever, elevated kidney values in blood tests known as azotemia, the presence of bacteria in urine, pain upon abdominal examination, and an increased number of neutrophils, a type of white blood cell. We might also see abnormalities on ultrasound, such as a widening of the renal pelvis, the central collecting area of the kidney. However, the researchers point out that these indicators can be unreliable and not specific to pyelonephritis. Currently, the most definitive way to diagnose this kidney infection involves a procedure called ultrasound-guided pyelocentesis. This is an invasive technique where a needle is guided by ultrasound to collect urine directly from the renal pelvis for analysis and bacterial culture. This method requires a skilled operator and is not always possible, especially if the renal pelvis is not sufficiently dilated. In human medicine, the presence of fever alongside a clinical diagnosis of a urinary tract infection is a strong indicator of pyelonephritis, as fever is less common in simple bladder infections. Similarly, elevated white blood cell counts or increased levels of a protein called C-reactive protein in the blood can suggest a kidney infection in humans. The study authors emphasize that accurately diagnosing bacterial pyelonephritis in veterinary medicine is crucial because it has significant implications for how we treat the animal and what the likely outcome will be. They then introduce a group of proteins known as positive acute phase proteins. These are substances whose concentration in the blood increases when there is inflammation in the body. One such protein, called Serum Amyloid A (SAA), has been gaining attention in veterinary medicine. Increased levels of SAA have been linked to various inflammatory, infectious, or cancerous processes. In human medicine, other acute phase proteins like C-reactive protein and procalcitonin have been investigated for their role in diagnosing bacterial pyelonephritis. Some research in children suggests that low levels of C-reactive protein might help rule out a kidney infection, but high levels are not specific enough to confirm it. Given this background, the researchers in this study set out with two main objectives. Firstly, they wanted to describe and compare the clinical signs, laboratory findings, and diagnostic imaging results in a group of cats suspected of having or confirmed to have bacterial pyelonephritis. Secondly, and perhaps more importantly, they aimed to evaluate how accurate measuring serum amyloid A levels could be in diagnosing bacterial pyelonephritis in cats. Their main idea was that cats with a kidney infection would have higher SAA concentrations compared to cats with other diseases of the urinary tract. They also suspected that cats with pyelonephritis would show more frequent changes in blood tests or ultrasound findings indicative of a kidney inflammatory process. To conduct their study, the team prospectively recruited adult cats over 6 months of age that were presented to the Veterinary Teaching Hospital of the École Nationale Vétérinaire d'Alfort between December 2018 and December 2022. The owners of these cats gave their informed consent for their participation. The study was ethically approved, and the animals were cared for according to established guidelines. The researchers included cats with a history or clinical signs suggestive of both upper and lower urinary tract diseases, such as frequent urination, blood in the urine, straining to urinate, increased thirst and urination, elevated kidney values, or abnormalities felt upon palpation of the kidneys or bladder. Cats could even be included multiple times if they had separate episodes of illness more than 3 months apart, with resolution of their previous issues. For all cats, they recorded their medical history, clinical signs, and any treatments given in the 15 days before their presentation, including antibiotics, immune-modulating drugs, and anti-inflammatory medications. All cats underwent a thorough abdominal ultrasound examination using specialized equipment. The size of their renal pelvis was carefully measured by a single trained operator using specific software and techniques. Urine samples were collected either by cystocentesis, which is needle aspiration of the bladder through the abdominal wall, from a port connected to a subcutaneous ureteral bypass device if the cat had one, or by ultrasound-guided pyelocentesis. The urine was analyzed to determine its specific gravity, checked with a dipstick for various substances, and the sediment was examined under a microscope. For bacterial culture, a portion of the urine was sent to a microbiology laboratory and incubated to see if bacteria would grow. Significant bacterial growth was defined as 1,000 or more colony-forming units per milliliter. If bacteria were found, They were identified using a technique called matrix-assisted laser desorption ionization time of flight mass spectrometry, and their susceptibility to different antibiotics was tested. Blood samples were taken from all cats to measure urea and creatinine levels, which are indicators of kidney function. Further blood tests were performed at the discretion of the attending veterinarian. The cats were then divided into two main groups. Group 1 included cats with confirmed bacterial pyelonephritis, which was based on a positive bacterial culture from urine collected directly from the renal pelvis, Group 1A, or cats in which pyelonephritis was highly suspected, Group 1B. Group 2 consisted of cats in which bacterial pyelonephritis was ruled out with certainty based on a negative bacterial culture from pyelocentesis, Group 2A, or those where it was judged very unlikely, Group 2B. The presumptive diagnosis of pyelonephritis in Group 1B required a compatible medical history and clinical course, along with at least 3 of the following criteria: azotemia, a positive bacterial culture from urine collected by cystocentesis, or a subcutaneous ureteral bypass device, a rectal temperature of 39.5 degrees Celsius or higher, and a renal pelvic dilation of 1 millimeter, or more seen on ultrasound. Cats were placed in Group 2B if their history and clinical course made pyelonephritis unlikely, and they had fewer than 3 of these criteria. Cats that had received antibiotics and had negative cultures from pyelocentesis were also included in Group 2B if they met the other criteria for being unlikely to have pyelonephritis. Cats with obvious inflammatory, infectious, or cancerous diseases unrelated to the urinary tract were excluded to avoid affecting the SAA measurements. Cats with urethral obstruction were also excluded because previous research had shown that acute phase proteins can increase in these cases. To avoid the influence of hospitalization itself or exposure to hospital-acquired infections on SAA levels, cats in whom SAA was measured more than 48 hours after admission were not included. Finally, cats with incomplete medical records were also excluded. Importantly, the use of antibiotics, immune-modulating drugs, or anti-inflammatory medications before the cat was presented to the hospital did not automatically exclude them from the study. Serum amyloid A concentration was measured within 48 hours of sample collection without freezing the samples, using a validated test for cats with a lower limit of detection of 1 mg per liter. Statistical analyses were performed using commercially available software to compare the different groups and to assess the accuracy of SAA in diagnosing pyelonephritis. Turning to the results of this comprehensive study, a total of 149 observations from 125 individual cats were included after a thorough exclusion process. Most cats were included only once, but some had 2 or 3 separate episodes that met the inclusion criteria. The researchers found that the duration of clinical signs before presentation was significantly shorter in cats with confirmed or presumed pyelonephritis, Group 1, compared to those without, Group 2. Interestingly, 9 cats had received antibiotics before being included in the study, and all of them were in the group where pyelonephritis was judged unlikely, Group 2B. No cats had received immune-modulating or anti-inflammatory drugs prior to presentation. The methods used to collect urine and the results of the urine bacterial cultures varied between the groups. The researchers then compared the levels of serum amyloid A across the different groups. They found that median SAA concentration was significantly higher in cats with confirmed pyelonephritis, Group 1A, at 86.8 mg per liter compared to cats where pyelonephritis was ruled out with certainty, Group 2A, at 4 mg per liter, and those where it was judged unlikely, Group 2B, at 5.4 mg per liter. Similarly, the SAA concentration was also significantly higher in cats with presumed pyelonephritis, Group 1B, at 98.8 mg per liter compared to both Group 2B and Group 2A. Other differences in SAA levels between subgroups within Group 2 were not statistically significant. They also found no statistical link between the presence of a subcutaneous ureteral bypass device and an increase in SAA concentration. When they looked at how many cats had SAA levels above the normal reference range, they found that 100% of cats in both the confirmed, Group 1A, and presumed, Group 1B, pyelonephritis groups had elevated SAA, while none of the cats in the group where pyelonephritis was definitely excluded, Group 2A did. Only 17% of cats in the group where pyelonephritis was judged unlikely, Group 2B, had increased SAA levels. The proportion of cats with high SAA was significantly greater in both Group 1A and 1B compared to both Group 2A and 2B. When the researchers combined the confirmed and presumed pyelonephritis groups, Group 1, and compared them to the combined groups where pyelonephritis was excluded or unlikely, Group 2, they found that SAA concentration had an excellent ability to distinguish between the two, with an area under the curve of 0.96 in the receiver operating characteristic analysis. The optimal cutoff value for SAA concentration to diagnose pyelonephritis was determined to be 51.3 milligrams per liter. At this cutoff, the test had a sensitivity of 88%, meaning it correctly identified 88% of cats with pyelonephritis, and a specificity of 94%, meaning it correctly identified 94% of cats without pyelonephritis. The positive and negative predictive values, which indicate the likelihood of having or not having the disease, given a positive or negative test result, varied depending on the assumed prevalence of pyelonephritis. Interestingly, when they repeated the analysis excluding the cats that had received antibiotics before presentation, the accuracy of SAA even improved, with the area under the curve increasing to 0.98, and a different optimal cutoff of 25 milligrams per liter, yielding a sensitivity of 100% and a specificity of 94%. In the discussion section, the authors emphasized that the diagnosis of upper urinary tract infections in cats remains a significant challenge in clinical practice due to the limited information available in veterinary literature. They suggest that pyelonephritis might be underdiagnosed in some situations and overdiagnosed in others. Their finding of pyelonephritis in one cat without elevated kidney values highlights the difficulty of relying solely on traditional signs. While SAA is increasingly being used as a general marker of inflammation and cancer in cats, its specific usefulness for diagnosing pyelonephritis had not been thoroughly investigated before this study. The researchers conclude that SAA appears to be a valuable tool in diagnosing bacterial pyelonephritis in cats, as it was more commonly elevated in cats with upper urinary tract infections compared to those with other urinary tract or kidney diseases. They note that SAA seemed to be more sensitive than specific, meaning a low SAA level makes pyelonephritis unlikely, but a high level could be due to pyelonephritis or another inflammatory condition. The authors discuss the few cases in their study where cats in the group without confirmed pyelonephritis, Group 2A, had increased SAA levels. They point out that these cats were receiving antibiotics at the time of sampling, which might have led to them being misclassified if they actually had pyelonephritis but the infection was being suppressed. The observation that the sensitivity of SAA for diagnosing pyelonephritis reached 100% when cats receiving prior antibiotics were excluded is particularly interesting, suggesting that in cats not recently treated with antibiotics, a normal SAA level might very reliably rule out a kidney infection. The study also found that, apart from SAA, no other blood test variables were significantly different between the groups. While increased neutrophils were the most common blood abnormality in cats with pyelonephritis, followed by increased monocytes, the researchers believe the lack of statistically significant differences in these parameters between the groups might be due to the limited number of cats in the pyelonephritis groups. The authors underscore the importance of accurate diagnosis for guiding treatment decisions. They mention that fluoroquinolone antibiotics are often recommended for upper urinary tract infections, but their use is restricted in some regions due to concerns about antibiotic resistance, making definitive diagnostic evidence even more critical. They also note that while pyelonephritis traditionally required longer antibiotic courses than bladder infections, current recommendations suggest shorter durations of 7 to 14 days for acute cases might be sufficient. The researchers acknowledge that current diagnostic criteria for bacterial pyelonephritis in cats are not well established. While international guidelines suggest relying on a positive urine culture along with systemic signs, renal pain, azotemia, and neutrophilia, the authors point out several limitations to this approach. These signs are more common in acute cases and might be absent in chronic infections. Furthermore, not all cats with pyelonephritis will show all these classic features, such as fever or renal pain. The study found that only 38% of cats with confirmed upper urinary tract infections had a fever. Azotemia is also not a consistent finding, especially since pyelonephritis can occur alongside pre-existing kidney disease or ureteral obstruction. The authors also highlight that subclinical bacteriuria, the presence of bacteria in the urine without clinical signs, is common in older cats and those with chronic kidney disease, making it difficult to interpret a positive urine culture alone. Additionally, discrepancies can occur between bacterial culture results from urine collected by cystocentesis versus pyelocentesis, especially in cases of ureteral obstruction. The study also touches on the role of ultrasound in diagnosing pyelonephritis, noting that while certain findings like increased echogenicity of the kidney tissue or pelvic dilation are suggestive, there is a lack of strong evidence-based data defining specific ultrasonographic features of feline pyelonephritis. This is partly due to the difficulty in establishing a definitive diagnosis to compare against. Their study group allocation was primarily based on the presence or absence of renal pelvic dilation. However, they acknowledge that pyelonephritis can occur without significant dilation or other ultrasound abnormalities, and suggest that future research should explore other ultrasound criteria and potentially incorporate SAA measurements to improve diagnostic accuracy. Interestingly, the study found a high prevalence of urinary stones in cats with presumed or confirmed pyelonephritis, suggesting that these stones might be a risk factor for developing kidney infections, similar to what is seen in humans. A significant proportion of cats in the study had a subcutaneous ureteral bypass device in place, which the authors recognize could complicate the diagnosis of pyelonephritis due to potential mild pelvic dilation, even without infection or obstruction. While they found no direct association between the presence of a bypass device and increased SAA in their study, they emphasize that the long-term effects of these devices on SAA levels are unknown, and that differentiating between kidney and bladder infections in cats with these devices is challenging. They believe their study provides a valuable tool for this differentiation. The authors conclude by reiterating that definitive diagnosis of bacterial pyelonephritis in cats remains a challenge due to nonspecific clinical signs and the invasiveness and limitations of current confirmatory testing. They emphasize the need for an easily accessible and accurate diagnostic tool to distinguish pyelonephritis from other urinary tract and kidney diseases. Their study demonstrates that serum amyloid A concentration is significantly higher in cats with confirmed or presumed bacterial pyelonephritis, and that measuring SAA using a threshold of 51.3 mg per liter appears to be sensitive for diagnosing this condition, potentially serving as a useful test to rule out pyelonephritis when the suspicion is low. However, they caution that SAA is not specific for bacterial pyelonephritis and can be elevated due to other inflammatory conditions. Thank you for listening to the Veterinary Research Channel. A link for the reference paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.